My name is Alida. I'll be doing an assessment today. What is your name?
Gabriel,
When is your birthday?
March 22nd, 1999,
Do you know where you are?
at home,
Do you know what year it is?
2013,
Okay, Gabriel is alert, oriented, time is free, appropriate affect, and appropriate mood. Now I'm going to let him walk to check his gait. So far is normal gait. Now I'm going to let him do the tandem walking heel to toe. Okay, so the tandem walking is negative, it's normal. Now I'm going to do the range of motion of the spine. First, I'm going to check the spine for tenderness. There is no tenderness. Now I'm going to let him do the flexion, which is bending forward, extension, standing up, lateral bend. Okay, the other side. Now I'm going to hold his hips for rotation. Okay, rotate please. Okay, now can you turn around? Now I'm going to check for scoliosis. Make sure that I check the shoulder, the scapula, the iliac crest, and the gluteal fold for symmetry, for evenness. So far they're all even. Now I'm going to let him bend forward. So I'm checking for the symmetry and evenness of the scapula and the gluteal fold and the iliac crest. So far they're symmetrical. Can you please stand up? Okay, and the spine is straight. So now what I'm going to do is I'm going to let him do the Romberg test, which is standing straight with his eyes closed, with his feet together. Feet together, okay? Romberg test is negative. Now I'm going to check for the upper extremity. The upper extremity is dry and intact, so there is no lesion. So now what I'm going to do is I'm going to do the range of motion of his shoulder, okay? Flexion, okay? Extension, abduction, adduction, external rotation, okay? Internal rotation, okay? Elbow, flexion, extension, supination, pronation, okay? The wrist, flexion, extension, abduction, adduction, okay? The fingers, flexion, extension, abduction, adduction. Okay, now what I'm going to do is I'm going to test the strength of his shoulder. Can you please put your shoulder up? Okay, don't let me push it down. Okay, don't let me push it up. Okay, so bilateral strength of the shoulder. Now I'm going to do check the deep tendon reflexes. Okay, I'm checking for the tricep over here. Okay, and then the bicep antecubital. Okay, the brachioradialis. Okay, I'm checking for the patellar reflex. Okay, patellar reflex. Okay, and then I'm going to check for the Achilles at the back. Okay, I'm going to check for the Babinski reflex using the end of my reflex hammer from heel to the peep toe to the great toe. Okay, there's no fanning, and I didn't see any clones. Now what I'm going to do is I'm doing for the skin turgor, checking the skin. The skin is smooth and the skin is dry, warm and dry. Now I'm going to check for the skin turgor. I'm going to pinch over the clavicle. Okay, so it's elastic. It's less than 3 seconds. 3 seconds. So now what I'm going to do is I'm going to check for the hair. The hair is black. It's coarse. It's evenly distributed, and I don't see palpating the scalp. I don't see any lumps. Okay, I'm going to check for the nails. The nails are pink. They'll wear rounded. I'm going to check for capillary refill. Okay, less than 2 seconds. Now I'm going to check for the cranial nerve 7, which is the facial. Can you please smile? Show me your teeth. Frown. Okay, pop out your cheeks. Raise your eyebrow. Okay, close your eyes. Don't let me open them. Okay, so that's cranial 7. Cranial nerve 7, which is facial. Now I'm going to check for the cranial nerve 5. First, I'm going to let him clench his teeth. Okay, I'm going to palpate the temporal muscle. I'm going to palpate the masseter muscle. Okay, now I'm going to check for the sensory. I'm going to use a sharp and dull object. Okay, and then I want you to close your eyes and you tell me if it's sharp or dull. Okay, so now I'm going to check for the cranial nerve 5.
No. 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 Sharp. Sharp.
Okay, so that's cranial nerve 5. So now what I'm going to do is I'm going to palpate for the sinuses. The sinuses, the frontal sinus and the maxillary sinus. Okay, so far there's no tenderness on the maxillary sinus and the frontal sinus. Now I'm going to check the eyes, which is I'm going to check the eyebrow. They're symmetrical. The eyelids, there's no ptosis. The eyelashes, they're evenly distributed. I'm going for the sclera. The sclera is white. Okay, the cornea is clear, and then I'm going to check for the conjunctiva. Okay, the conjunctiva is pink. Now I'm going to check for the pupil. Okay, the pupil is 4 millimeters right now. Okay, all right. Okay, the pupils is from 4 millimeter to 2 millimeter. It's pupil equal, round, reactive to light. So now I'm going to check for the convergence and accommodation. Can you please look at my follow my pen light? Convergence, also accommodation, negative. So now what I'm going to do is I'm going to check for the cranial nerve 3, 4, and 6, the 6 cardinal field of gaze. Follow my finger. Okay, so normal. So now what I'm going to do is do the cover and uncover test. Okay, and I'm also going to do the Hirschberg test. Okay, cover and uncover test, negative for nystagmus, and also the Hirschberg test is the light reflex is on 1 o'clock, they're negative. So now I'm going to check for the lacrimal gland for tenderness and for the puncta. Okay, there's no tenderness on the lacrimal gland, and the puncta is there no discharges. Now I'm going to check for the optic disc for the ophthalmoscope. Okay, I'm going to use my right eye to his right eye. So I'll be standing 15 degrees from him and look for the arm's length and look for the red reflex. Once I see the red reflex, I'm going in. Okay? Right now, I see the red reflex. Okay? And I'm going to check for the optic disc. Okay? So, okay, the optic disc is sharp. Now I'm going to the ears. The ears are symmetrical. They're in alignment with the eye. I'm going to check for the auricle and the mastoid process. The auricle is pink and dry. I don't see any discharges. The mastoid process is there's no tenderness. Now I'm going to use my ophthalmoscope. Okay. First, I'm going to pull in and out, and then I'm going to brace my hand on his head, and then check the internal ear. Okay, I see the umbo, the cone of light, the handle of malleus, and the short process of malleus, and the tympanic membrane is pearly gray. Now I'm going to check for the cranial nerve 8. I'm going to check for the cranial nerve 8, which is acoustic. Okay, you hear it? Okay. Okay, so the air conduction on the Rini test, the Rini test is air conduction is greater than bone conduction. Now I'm going to do the whisper test. Can you include your 1 year, please? 77. Okay, so whisper word test is negative. So now what I'm going to do is I'm going to check for the nose. The nose, the alignment of the nose is in alignment. Do you have any problem with your nose? Uh, can you occlude one your nostril? Any problem? The other? No. Okay. So now I'm going to check. I'm going to check the the ear, the nose. Nose. Okay. Right. So the nose is pink and moist, and the turbinates, the middle and the inferior turbinates, I could see. So there's no problem with the nose. Uh, Now what I'm going to do is I'm going to go to the mouth, the lips. The lips is pink. I'm going to to check the mouth. Okay, the gums. Open your mouth, please. The gums are pink. Okay, the teeth are white. Okay, there's no lesion. The soft and hard palate is pink. Say ah. Okay, the uvula is midline, and the tonsil are not enlarged. So saying ah, that means it's the cranial nerve, which is vagus. Now I'm going to check for the GAB reflex, which is the cranial nerve 9, which is glossopharyngeal. Okay, I'm going to press your tongue at the end, both sides, and elicit GAB reflex. Okay, so positive gag reflex. Okay, now what I'm going to do is I'm going to check for is the tongue movement. Can you open your mouth, please? Okay, can you stick out your tongue? Okay, can you press my hands against your tongue? Good. Okay, good. So now the tongue movement is good. Now I'm going to check for the lymph nodes. So pre-auricular lymph nodes, post-auricular lymph nodes, occipital lymph nodes. Okay, this is the tonsillar, submandibular, submental. Okay, posterior cervical, superficial cervical, deep cervical. Okay, can you shrug your shoulder, please? Supraclavicular and infraclavicular. So all the lymph nodes are negative. So now what I'm going to do is the range of motion of his neck. Can you flex your neck? Flexion. Okay, extension, hyperextension, lateral bending, rotation. Okay, rotation. Range of motion of the neck is good. Now I'm going to check for the trapezius muscle and sternocleidomastoid muscle. Can you shrug your shoulder, please? Okay. Don't let me push it down. Don't let me push it down. Okay. Can you press my hands against your head? Okay. All right. Okay. Okay. So that's cranial nerve 11, which is spinal accessory. Now what I'm going to do is I'm going to assess for his thyroid. The thyroid is midline, and then I'm going to check for the thyroid. So I'm going to look for his cricoid process. okay, the cricoid, and then I'm going to check for the thyroid. I'm going to displace the trachea. Can you turn on your left? Okay. Now I'm going to palpate the thyroid on the left. Can you swallow? Okay. All right. Then the other side. Okay. Swallow. Okay. So the thyroid are not enlarged; they're normal. So if I need to auscultate, if the thyroid are enlarged, I'm going to auscultate for brewing. So now I'm going to check the posterior chest. So the posterior chest is normal in alignment. I don't see any lesion. The skin is clean. So what I'll do is assess for premitus using my ulnar aspect of my hand. When I put my hand on your back, can you please say 99?
99, 99, 99, 99.
Okay, so the premitus is equal bilaterally. Now I'm going to auscultate using the diaphragm of my stethoscope, and then I'm going to auscultate 14 areas of the back. 1, 2, auscultating a full breath. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So lungs are clear. So same thing with the front anterior chest. I'm going to check the anterior chest. The skin is dry and intact. So I'm going to auscultate. I'm going to auscultate using the diaphragm of my stethoscope 12 areas. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. Okay, so the lungs are clear. Now I'm going to measure the AP diameter of the chest. The lateral is 1 width, and it's supposed to be equal to 2 widths of the anterior chest. 1 makes it 2. Okay, AP diameter is 2 to 1. Now, what I'm going to do is I'm going to check the lymph nodes. I'm going to palpate the lymph nodes. First, I'm going to hold this hand. I'm going to palpate with the pads of my hand the lateral, which is rotating motion. And then I'm going to palpate the central, which is going towards the neck, with the position my hand like this, palpating, going up, okay, rotation. And now I'm going to check the anterior. I'm going to brace, and then using my finger, I'm going to palpate down for the anterior. And then with the posterior, I'm going to palpate using the pads. I'm going to palpate for the lymph nodes. So far there's no lymph nodes. Now I'm going to check the breast. Can you please stand up? Okay, I'm going to teach the patient also to do self-breast examination. While standing in front of the mirror, you could put your hands down, okay? Check for breast symmetry, okay? Hands on your hips, okay? Raise your hands up, and then bend forward. Okay, so check for symmetry of your breast. So far they're symmetrical. I don't see any dimpling. I don't see any lumps. So now I'm going to tell the patient to lay down. Okay. Okay. Doing self-breast examination. Can you please put your hands above your head? Okay. So now I'm going to teach the patient to palpate the breast from central to lateral, from the chest, strip method, going up and down, up and down, and make sure to include the tail of his pants. And then make sure that check for nipple discharge. Press the nipple for nipple discharge. So when you do your self-breast examination, make sure you do it before ovulation, just after your menstruation. You do it. You do it strip down, up and down, up and down, and make sure that you cover all the breast and the tail of pants. Okay, so now we're going to do the cardiac area. The cardiac area, there's 5 areas in the cardiac area that I'm going to palpate and auscultate. First, I'm going to palpate the aortic on the second intercostal space, right sternal border. The pulmonic is on the second intercostal space on the left sternal border, and the second pulmonic is in the third intercostal space. And then the fourth and fifth intercostal space is the tricuspid, and then the fifth intercostal space mid clavicular line is the mitral. So I don't feel any hips, lips, or trills. Now I'm going to auscultate using my diaphragm, and also I'm going to auscultate using the bell. Aortic, pulmonic, second pulmonic, tricuspid, and then mitral. Okay, using the bell, aortic, pulmonic, second pulmonic, tricuspid, and then mitral. So far, normal rate and rhythm. Now I'm going to go to the abdominal area. Okay. The abdominal area I'm going to inspect. Make sure that that there's no hernia. The abdominal area is the skin is dry and intact. It's well rounded. Now I'm going to do the auscultation. 4 quadrants. Okay, right upper quadrant, left upper quadrant, left lower quadrant, right lower quadrant. So far is positive vowel sound. So now I'm going to auscultate for bruit using my bell of my stethoscope. Okay, aortic, aorta, renal, renal, iliac, iliac. Okay, so I don't hear any bruit. Now I'm going to do the percussion. Percussion of the 4 quadrant. Okay, so now it's tympanic. Now I'm going to percuss the liver. Resonant, 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 dull. Tympanic, 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 dull. Okay, so the liver should measure between 6 centimeter to 12 centimeter. I'm going to percuss the spleen on the lateral axillary line, and then I'm going to tell the patient to take a deep breath. Deep breath, please. Okay. Okay. Now what I'm going to do is I'm going to do light palpation. Light palpation. There's no tenderness. Now I'm going to do the deep palpation. Deep palpation. Deep palpation. Deep palpation. Deep palpation of 4 quadrants. Now I'm going to do deep palpation of the liver. I'm going to put my hand underneath him, and then I'm going to tell him to take a deep breath, and then I'm going to hook my finger, my fingers underneath the last intercostal space. Okay, take a deep breath. Okay, and then palpate for liver enlargement. Same thing with the spleen. I'm going to put my hand under his back, and then I'm going to tell him to take a deep breath on the last intercostal space. I'm going to do a hook, and then palpate for spleen enlargement. Now I'm going to do the range of motion of the hips. The range of motion of the hips, first is flexion, Okay. Extension, abduction, adduction, external rotation, internal rotation. Now I'm going to do the knee flexion, extension. Now I'm going to do the foot, which is dorsiflexion, plantar flexion, inversion, going in, inversion, going out is eversion. So now I'm going to palpate his pulses. The temporal pulse, the carotid pulse, his femoral pulse, and then I'm going to check to palpate for the dorsalis pedis pulse, and also the posterior tibialis. I will also make sure that I will check the strength of the lower extremity, both legs. But I'm just going to do the one leg right now. So I'm going to tell him to don't let me push up your leg. Okay, don't let me push it down. Okay, and then same thing with the other leg. Okay, don't let me push it up. Okay, don't let me push it down. Okay, that concludes the physical assessment. Now, what I'm going to do, is I'm going to do the assessment of the male genitalia. Uh, First, I'm going to let the patient stand up while I'm sitting down, and of course he will be disrobed waist down. So I'm going to check his penis for uh, any lesion or any check for any discharge, and then I'm going to check his prepuce, if it's if the patient is circumcised or uncircumcised, and then I will also check, make sure that the scrotum, the left is lower than the right, and also if the patient complain of any discharge that I cannot see, I'm going to tell the patient to to milk the penis from the shaft of the penis, from the base to base, from the base to the tip of the penis, so I could get this for some culture. And after that, I just want to make sure that also the urethral meatus is midline and the slit is vertical. After that, I'm going to teach the patient to do testicular exam, and also I will do a testicular exam. Using the pad of my finger, I will palpate behind the scrotum, make sure that I palpate the testicle for any tenderness or for any tenderness or lesions, and the testicle is supposed to be feel like a boiled egg with the shell out, with no shell. Um, and then I'm also going to palpate for hernia. Using my right index finger, I'm going to behind the scrotum, going to the scrotal sac, to the inguinal ring, and then I will ask the patient to turn his head and bear down. Same thing with the left. I will let the patient. I will use my left finger and do the same thing. Now, if I have to check for the prostate, what I'll do is I'm going to let the patient lean over on the exam table with their shoulder on their elbows, lean forward on the examination table with their elbows, and then with toes in, and then I'm going to insert my finger, glove finger, and then make sure the sphincter is relaxed, and I'm going to aim at the umbilicus and make sure palpate the posterior aspect of the prostate, and also it's a heart shape with the median sulcus, and then make sure check for any tenderness, and then it's supposed to feel like rubbery and non-tender, and then make sure that I check the color of the fecal material on my glove, and then do a cold blood. That's the end of the assessment. Thank you.